Imagine this. One cold December evening, you're carrying your garbage out to the roadside and you realise that you're struggling to breathe. And as you walk up your stairs to go to bed, you become dizzy and winded. The ambulance takes you to the emergency department, where you're diagnosed with pneumonia. You're started on antibiotics and sent home again. But 3 days later, when you get up out of bed in the morning, you become very dizzy and you pass out. On your second visit to the emergency department, the doctor organises a lung scan and they tell you that you have blood clots in the lungs, not pneumonia. You overhear a staff member comment that you're lucky to have survived. My name's Kerstin de Wit. I'm a professor in emergency medicine at Queen's University, and I've been studying emergency blood clots for most of my career. Let me tell you about my journey. One summer, when I was a medical student in Scotland, I was sent to work in a community hospital. The hospital was set in a beautiful green field beside an old Scottish town at the foot of 3 ancient hills. These hills were once the home to a Bronze Age fort and then a Roman fort, and are now deeply ensconced in the local folklore. The hospital was very small, and patients lay in their beds, gazing out of the window at rabbits grazing in the field. And the nearby River Tweed meandered through the countryside. Every morning at 8 a.m, I joined the ward round, where doctors all dressed in white coats gathered in order of seniority to join the staff doctor and walk from bed to bed. It was the most junior doctor's role to push the trolley that contained all the medical records for each of the patients. The staff doctor would stop at the end of the bed, speak briefly to the patient, bark questions at the assembled audience, and then declare what the next steps were. An exercise test for a man who came in with chest pain, a brain scan for a woman who became confused, and a lung scan for a man who's feeling short of breath. The junior doctors scurried around in silence, sometimes organising the tests as the ward round progressed, and other times adding to their list of work for later in the day. We were wrapping up at the end of the day when the results of the lung scan came back, having diagnosed pulmonary embolism. You'll hear me talk a lot about pulmonary embolism, but for now I'll tell you that pulmonary embolism is blood clots in the lungs. Something wasn't right about the scan report. It had the wrong patient name, and it took us 5 minutes to work out what had happened. The junior doctor had accidentally used the wrong patient identification sticker when they were writing out the request for the lung scan. So the patient in the bed next door to the patient who was supposed to have the lung scan actually had the test. And it turned out that the patient in the bed next door had pulmonary embolism. And what about the man who was supposed to have this test? Well, he turned out not to have pulmonary embolism at all, and we'd actually stumbled on the diagnosis in his neighbour by mistake. And this was my introduction to diagnosing pulmonary embolism. Pulmonary embolism is a condition that happens when the blood starts to clot too much. Everyone knows that the lungs bring oxygen into our blood, but few people know that the lungs are actually our blood's filter. And it's the job of the lungs to remove anything solid that's traveling in our bloodstream. So when the blood starts to clot too much, pieces of blood clots move with the blood flow, and it's our lungs' job to remove these pieces of blood clot to protect us against having a stroke or a heart attack. So when there's abnormal blood clotting, the first place that the blood clots show up is in the lungs, and that's right where they're supposed to be. This condition can be treated easily with tablet blood thinners at home. But very occasionally, The lung filters get so clogged up with blood clots that the blood flow can't move easily through the lungs. And when that happens, pulmonary embolism can become fatal. I'm going to move forward in time 20 years from when I was a medical student. I'm now living in Burlington, Ontario, and I'm working as an emergency doctor. My husband and I live in a small house in a road that's lined with rambling lots, all backing onto a forest. Our neighbours are retired, and this is a close-knit community. In the summer, we all go round to Dave and Betty's house, where we enjoy fresh Italian food and homemade tomato sauce. Betty and I exchange notes on the oriole birds, and we're wondering when they're going to fly south again. In the winter, we cross the road to Ben and Helen's house, where we enjoy Helen's holiday decorations and have a drink. I find a store next to the hospital, and it makes authentic Scottish haggis. So every January, everyone comes to our house for a Scottish burn supper. I was working on a grant at the kitchen countertop when Ben, my neighbour, knocked on the door. Something was wrong with Helen. We walked across the road together, and we found Helen sat in the living room chair looking upbeat and healthy. She told me that she felt short of breath walking up the stairs carrying the laundry. I took her pulse, and we agreed that she would keep the appointment with the family doctor that afternoon. 2 days later, I had a voicemail from Ben telling me that the family doctor had admitted Helen into hospital. And then later, the following weekend, I was stood in Toronto train station when my neighbour Betty called me, and she told me that Helen had died that day in hospital, and that she had died from pulmonary embolism that was diagnosed too late to make a difference. And this brought me back in time to when I was a medical student 20 years beforehand, when all the doctors on the ward round missed that a patient had pulmonary embolism. How could I have known that Helen, my neighbour, had pulmonary embolism? Well as being an emergency doctor, I am a pulmonary embolism expert doctor, and I treat patients from across our region with this condition. And I have been researching how to improve the way we test for pulmonary embolism since 2001. I eat, sleep, and breathe pulmonary embolism, yet I missed the diagnosis. How can I explain that I, an expert in pulmonary embolism, missed the diagnosis? And what's the impact of missing the diagnosis? It seems to me that missing the diagnosis of pulmonary embolism is quite common, because many of my patients who I see in clinic have visited more than one doctor before the diagnosis is made. Pulmonary embolism is confused for a heart attack, pneumonia, or asthma more often than we think. But when the heart tests come back normal, when the pneumonia doesn't get better with the antibiotics, or when the asthma doesn't respond to inhalers, the real diagnosis is made. Most of the time during that delay to the proper diagnosis, there's little impact on physical recovery. But misdiagnosed pulmonary embolism can leave people with long-term anxiety and mistrust in the medical system. And very occasionally, the lung filters become so clogged up with blood clots that patients can die before the diagnosis is made. To understand how pulmonary embolism can be misdiagnosed, you have to know that pulmonary embolism gives people shortness of breath or chest pain, or it can make them faint. But by far the most common symptom is tiredness. And who here has never felt tired before? And I'm sure most of you have never had pulmonary embolism. The symptoms vary from one person to the next, and the symptoms are very common in people who book into the emergency department. And if we tested every person with these symptoms, then the waits for the scan would be weeks or months, and the whole system would grind to a halt. And people would have lung scan radiation without any benefit to them. So doctors have to use their clinical acumen to decide who should be tested for pulmonary embolism. In my research, the strongest message that I get is that emergency doctors are anxious about missing pulmonary embolism. They tell me that pulmonary embolism is the boogeyman of the emergency department, and they talk a lot about cases that are misdiagnosed. They see their role as spotting serious diagnoses, and failing to spot pulmonary embolism is failing as the emergency physician. But paradoxically, this anxiety about testing for pulmonary embolism is getting in the way of making the real diagnosis. Pulmonary embolism is a wicked problem. Only 2 in every 1,000 people who book into the emergency department have the condition. The symptoms are suggestive of other diseases, and examination by a doctor is almost always completely normal. This is where I'd like to tell you about Dennis. Dennis is a retired app developer and a member of my running club. I'd never really met Dennis, but I had seen him in the past taking club photos as we worked out on the track, and a common friend suggested that he talk to me. Dennis had been admitted into hospital with shortness of breath and misdiagnosed as having a heart attack. And it was 2 more days before his doctors realised he actually had pulmonary embolism. Since that time, he had followed stories in the newspapers about people who had died after they had been sent home from the emergency department with misdiagnosed pulmonary embolism. And he had wondered whether artificial intelligence could help doctors spot these cases. Dennis realised that doctors weren't always testing the right patients. If the right patients were tested, then lives could be saved. So we set about together to work on this. We gathered a small team with expertise in big data and emergency research. We analysed over 14 million emergency department visits in Ontario. And we worked out that every year in Ontario, there are more than 1,500 cases of misdiagnosed pulmonary embolism. We looked at the risks for somebody booking in with pulmonary embolism, and we identified these as the person's age, their symptoms, the triage nurse assessment, whether they've ever had a blood clot diagnosed in the past, having cancer, or having had recent surgery. And we put each of these risk factors into an AI model, and we found that this model helps guide doctors test the right patients for pulmonary embolism. We call our AI model PE Nudge. What if PE Nudge could work behind the scenes in the emergency department as a patient books in? The model would examine the medical records, and when it identified a person who was at risk of having pulmonary embolism, it would send a screen message to the doctor. Have you considered pulmonary embolism? Sometimes breakthroughs come from where we least expect them. Dennis knew nothing about the many years of research and hard work that's gone in to try to improve the way we test for pulmonary embolism, and to him it was obvious we need to test the right patients. It's been a steep learning curve. Dennis has had to learn to work with medical data and the restrictions around its use. Many of his good ideas have been thwarted by regulation. Our research team has learned to work remotely across Ontario. Our highlight was when Dennis presented our results to the Ministry of Health in Ontario last year. We are the only research group in the world who are working to guide emergency doctors on who should be tested for pulmonary embolism. We need to make PE Nudge the best it possibly can be at identifying pulmonary embolism. This research is challenging because we need to enroll hundreds of thousands of people booking into emergency departments across many hospitals. The research is expensive and we're looking for funding. We're not afraid to do this research because we know we can make a difference. Imagine this. One cold December evening, you're carrying your garbage out to the roadside, and suddenly you find yourself struggling to breathe. And as you walk up your stairs, you become so dizzy and winded that you collapse to the ground. The ambulance comes and takes you to the emergency department, where the triage nurse records what happened to you. Within minutes, a doctor appears at your side because the system flagged you as potentially having pulmonary embolism. An hour after you collapsed, you are diagnosed with pulmonary embolism and treatment is started. It takes weeks for you to recover, but you know you're safe, you have full trust in the medical system, and you're looking forward to your future. Pulmonary embolism is difficult to diagnose, and sometimes people die before the diagnosis is made. PE Nudge is an AI model designed to help doctors spot pulmonary embolism. If we succeed in our research, then one day in the future, emergency doctors will say to all their patients with pulmonary embolism, "We've got this, you're safe in our care, you're going to be okay."